today we will see the surgery that is an ophthalmology, where we'll see the cataract. Okay, cataract removal, cataract procedures, and we'll see how to navigate the simple cataract and the complex cataract and how it navigated and how it occurs. Okay, so see these two. First of all, we have to know the anatomy of the cataract. So, guys, what is cataract? What is cataract? So cataract is nothing, just an eye becomes cloudy, fog, and it often appears like a window fog. And how you'll feel if your natural eye lens become fog, how you'll see. So it generally treatment provided is that is a removal of cataract. So it will not disturb our daily life. Okay. So what's the main reason of the cataract? Basic reasons are there that is like aging, family history, steroid or drug use, injury, long-term exposure to the sun, and previous eye surgery. Okay, the only way is to remove the cataract. Okay, that is surgery. Removal of cataract and the insertion of the artificial intraocular lens. Okay, so come to the procedure. Okay, that is a simple OP of the cataract. Okay, so here the patient was taken to operating room where the rent, steam, anesthesia protocol was followed using the Vivital and alfentanil. Topic triticum drops was applied and operative eye is wrapped and wrapped using sterile fashion and lid speculum was inserted. So here the what is the technique? We are using of the jet operating microscope, a highly recommended microscope which is used during the ophthalmology procedure. After that, using this microscope, a lateral clear corneal approach was utilized and a stab incision was made with a diamond blade to right of the lateral limbus with the anterior chamber filled with the intracameral lidocaine and vasoplastic. And the three single pass clear corneal incisions were just anterior to the vascular arcade to temporal limbus using diamond keratome, and the 5 to 5 mm of the anterior capsular rectus was created, and the nucleus was hydrodissected and hydrodelineated and was freely movable in the capsule bag. The nucleus was phacoemulsified using the quadratic divide and contour technique. Following the deep groove formation, and the lens was bimanually and resulting quadrants and epicortex moved under the high vacuum burst more phacoemulsification. Cortex was removed in the irrigation and aspiration handlepiece, and the posterior capsule was polished, and the capsular bag was expanded and was viscoplastic. The implant was inserted, inspected under the microscope, found in the free defect, and implanted was inserted into the cartridge system under the viscoelastic and placed in capsular bag, trailing haptic and position with the cartridge system, and the residual viscoelastic was removed and anterior chamber from the behind of the implant, and corneal wound was hydrated and balanced salt solution. Anterior eye chamber was fully reformed and the side ported incision. The wound was inspected and found to watered, and the intraocular pressure was adjusted, and the lid speculum was removed, and topical drops and his ointment was applied, and the eye was sealed, and the patient appeared to tolerate the procedure well and lacked operating. So basically, what are the key points while seeing the simple cataract? So basically, this is simple cataract. How we come to know that is simple cataract? How we come to know that is simple cataract? So guys, there is a cornea clear incision. Okay, clear incision was made. An anterior capsular rectus was created. A window. It's a window for which it is created to remove the uh, cloudy lens. Okay, so capsular rectus is created, and hydrodissection and hydrodelineation of the nucleus was done, and there is an vacuum emulsification, Phacoemulsification has been done. So, can anyone say what is the phacoemulsification? So, phacoemulsification is minimally invasive technique. Okay, basically a probe has been used to remove the cloudy lens, and after that, the insertion has been done. Okay, so phacoemulsification is, we can see here, cortex has been removed. You can see cortex was removed. After cortex removal, the capsular bag was expanded also, and IOL, the implantation was done. Okay, and no complication is there, anything, nothing is there, and posterior capsule has been intact. Nothing is there. So, this is a simple cataract. But what if there is an use of the iris expansion device? If some device is used, capsular tension ring is there, pupil stretching is there, trypan blue dye is there, jonular weakness, mature, hypermature cataract, and some complication is there. So, if these terms, that is the iris extension device, capsular tension ring, pupil stretching, trypan blue, and some any complication is there, na, then it is an what complex cataract procedure. So, coming to the navigation, okay. So here that is in procedure. First, what has done? That is in removal of cataract. Okay, removal of sorry guys, I will show you starting. Okay, removal. You can spell here cataract removal using phacoemulsification ultrasonography of cataract. Okay, you can say the what is where is ultrasound is here. So phacoemulsion basically define what ultrasound probe has been used. Okay, and after that there is a lens implantation. That is an artificial lens has been implanted. So it is an one stage procedure at the time of cataract extraction. Only one stage. So we'll choose that. Other specified because in simple, okay, no aqueous drainage device has been used. No. If there is lateralities there, give unspecified. 66982. That's an extra capsular cataract removal with IOL prosthesis, manual mechanical technique without endoscopic cyclocoagulation. Okay, how to navigate the complex removal of the cataract? Complex cataract. Hmm. Come here, complex cataract. If there is no phacoemulsification, the vitrectomy, nothing, lens implantation, synchronous, complex, iris expansion device, suture, endoscapsular ring, primary species, capsular access. While these, then we have to choose. Okay, this will come as complex cataract procedure. So guys, this is an complex procedure. What if there is a done? So we'll delete one. If laterality is there, then we have to add RT. Okay, if there is an LT, if there is an LT, we have to remove that. We have to give the LT laterality. This is an simple cataract removal. That's it, guys.